For my child, Benson Joshua Jombo, it was the previous years ago, as past the 1 and 9 months here. He started to get like malaria, and we bring it to our hospital there in Tanzania. Then they start to get injection, gentamicin. But at that time, it start to as ups appear in the femur, left femur.
Benson Jombo, as you can see the x-rays, is a small child, 1 year, 10 months old. And they actually came to see me in Tanzania during one of my visits to Tanzania, where I go once in 3 months. And the first time they came, they told me that this baby, of course he was not walking because he has no, I mean, as you can see, one of his legs is almost completely non-functional, and one of his limbs, lower limbs. And they were very keen to have him walk. And they told me that he had had an injection sometime when he was very young, and possibly it was, some people say it was when they were trying to reduce this hip dislocation or something to do with his hip, and he had this injection. The injection got infected, and then he had a very bad abscess and pus, and then finally the pus infected the bone, and then he landed up with a bone infection. And then, as you can see, the bone is, because of the bone, the infection all subsided, but because of the infection, as you can see, the bone has completely disappeared, and there's no bone left there. Actually, there's hardly any bone between here, and there's no bone here. There's hardly any bone between here and here.
They told us that just wait up to 6 months to wait. Yeah, we still to struggle. I see in my email, they are marketing that the specialist will come from India, and they reach at Dar es Salaam, Kocheni, the hospital which called the Sanitas. Yeah, I make to make a follow-up where I can reach and talk with those specialists concern my problem. Yeah, I struggle. Then I start to send the email, communicate with the sanitars there. They told me that it is true that their doctor will came from India.
So he came to me, and I told him that, look, the only thing we can offer you is to put what is called a fibular graft. That is, there is a bone in the leg called the fibula, which can be removed and used as strut grafts in various parts of the body. So I told him we can remove the fibula, and then we can put it here between these two bones and use it as a strut. It will also work as a graft, and then we will put what's called a cadaveric bone from the bone bank. Now in Tanzania they don't have any bone banks, so that's why I told him you'll have to come to India, because first of all I might require some special equipment like some special external fixators and things like that, and I will require this bone which I have to get from a bone bank. So it won't be available in Tanzania, so you have to come to India. So they finally did manage to raise funds. Initially they had some problem about funds, but they were able to raise funds, and they came in last week and on Wednesday.
I start to struggle. How can me get money to bring my child to India in order to get treatment? Spend me my every day, but keep pray for God and struggle. My relative, my company, they can help me some little. Yeah, at the moment from June I start to make arrangement. How can bring my kid to India? The company can support me somehow, relative can support me, and me, something which I have, I use it. I arrange the arrangement with my wife, and from 20 this month we start the journey from Tanzania to India. We reach here in 21 Western Day. and they welcome us well. We reach at the airport, they bring us, the took us to airport, up to hospital. Here, India, they are hospitality people. They welcome very well. There is no problem. We comfortable.
When they came in, the child was extremely anemic. So we spent a few days in building up the child, and once the hemoglobin was okay, then today what I have done is, I have done what I have just talked about. We took out a small piece of his fibula, we have put it in, fixed it there with a nail which has gone through from here till here, and put the fibular stud graft, and then we got this cadaveric bone, and we have put the cadaveric bone around this, and I think it should unite. I think he should do well, and hopefully, I mean, his father told me, he said, every night I only dream of seeing this little boy running, and I hope one day he will run. Maybe I'll be able to make his dreams come true.
Tumekuja hapa hospitali ya Nova kwa ajili ya tiba ya mtoto Benson, na tunashukuru Mungu. Mungu amesaidia, mtoto wetu anaendelea vizuri. Naamini kwamba atapona.
We are happy and we thanks Dr. Gautam together with the others doctor which they are cooperate together to make surgery, and we thanks our colleagues which help us to reach in India from Tanzania, our relative, my compound, and the other which help us reach in India. We hope until now that our kid is going to work.